Welcome, everyone. Thank you so much for joining us today. I'm Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Before we get started, I just want to go a few items with you all. Please note that tonight's session is being recorded for educational purposes. If you're interested in viewing the recording, they'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you're in listen-only mode. Everyone has music and hear a guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and our guest speaker will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you of us complete. Your feedback is important to us as we plan future programs. So joining us today, we have Angela Reddington. She is the Comprehensive Stroke Center Coordinator for the Department of Neurology at Massachusetts General Hospital. Angela has worked as a neuroscience nurse at Mass General for 18 years. She has experience in both the General Neurosciences Unit at Lunder 8 and the Neuroscience Intensive Care Unit at Lunder 6. As a stroke coordinator at Mass General, Angela ensures safe, timely, and efficient stroke care by collaborating with multidisciplinary teams to implement best practices and maintain high-quality patient outcomes. She joins us today to give a talk on stroke prevention education. So please join me in welcoming Angela.
Hi, everyone. I'm going to start out by attempting to try to share my screen. All right. All right. Are you able to see just my slides? Yes? Okay.
No, right now we can see the YouTube window.
Oh, that's not what I want. Let me stop for a second. This. How about now?
We can see the entire PowerPoint, including the thumbnail on the left with the slides.
All right, let's put that on presentation mode. Better.
Now we can see, it's in presentation mode, so we can see your notes.
Oh.
I don't know if there's a way to display settings so that it's.
Does that make it any better?
There you go. Perfect.
Okay. Okay, sorry about that. The two screens here at home really always throws me off. Anyways, again, and I got a new keyboard that takes up my whole desk. Doesn't fit where it usually fits anymore. So, starting fresh, I'm Angela. I'm the stroke coordinator at Mass General Hospital. I'm going to go over some very basic stroke information for everybody. My first disclaimer I want to note is that I'm at home, which is a perk, but I have two small children and a dog. So if you hear some random background noises, I apologize. That's completely normal in this household. Also, after having my daughter get sick last week and cough in my face about 17 times, I am now sick and congested. So I already preemptively took some cough medicine. I'm hoping to make it through this lecture, but I may need to take a break here and then if coughing occurs, or if I get a little stuffy and congested. I'm just going to apologize in advance. So I want to first go over stroke and just some basic information about background. Let's start with some statistics. So, stroke recently dropped to the fifth cause of death. We used to be the third, it used to be bad because we actually improved education in the public and we actually have new stroke treatments that can actually sometimes even cure a stroke or completely reverse the effects of stroke that we will talk about in this lecture. Um, and so with that new stroke prevention care and the new treatments that we have, we dropped to the fifth cause of death. One of the big takeaways is that this education is consistently worked on and improving and always want to be reinforced. Like, for example, one of the big things we'll talk about is that if you're having stroke symptoms, it's really important to call 911 immediately to have an ambulance bring you to the hospital. They found that only like 53% of patients actually called 911. A lot of patients got into their own car and drove to a hospital in Boston traffic. And as we'll learn, it's very important that we get treatment as soon as possible and get to a hospital because a lot of things are time sensitive when it comes to this treatment options. And we'll talk more about that shortly. Another thing to notice is that women are more risk for stroke than men, and this occurs after menopause, of course. You can blame menopause for another thing. But men usually have strokes at a younger age. Stroke is very common. It happens every 40 seconds worldwide. And that a lot of people don't realize is that once you have a stroke, you're a higher risk for having another stroke. You're not just cured. No, this actually puts you more at risk and to be aware of what those signs and symptoms of stroke are. Lastly, the biggest thing is that 80% of strokes can be prevented. And what do I mean by that? It means that 4 out of 5 strokes can be prevented by reducing your risk for having a stroke with healthy lifestyle changes and better lifestyle modifications. So let's go over the basics on what exactly a stroke is. So a stroke happens when something goes wrong with the blood flow in your brain. Your brain needs this constant supply of oxygen-rich blood in order for it to work properly. So if that flow gets blocked or a blood vessel bursts, which is what a stroke is, that brain does not get the oxygen that it needs. So you can see in this image that there's a lot of arteries. This is a very basic, but just to give you a good point, in your brain that carry blood to keep it oxygenated. And so if one of these arteries become blocks or becomes ruptured, this means that now this area of the brain isn't able to function properly or get oxygen that it needs to survive. And this is when brain cells die. And this occurs within minutes of having a burst or blocked blood vessel in your brain. And this is why we call it a medical emergency. You'll also hear stroke called a cerebrovascular accident or a CVA. But most people just know it as stroke, right? And one of the things is that because these brain cells die so quickly, time is critical. Like I mentioned before, and I'm going to mention about 17,000 times throughout this lecture, is that getting yourself to a hospital and getting evaluated for immediate treatment can save your brain function. It can save your life. So the faster you get to the hospital, the better chance of recovery and preventing long-term disability. So we actually have 2 kinds of stroke. If we want to break it down, let's first talk about an ischemic stroke. An ischemic stroke happens when a blood clot blocks the blood vessel in your brain. And this does not allow blood to supply the rest of the brain as it usually does. So it's like a clogged pipe. All right. The blood can't get through. So part of your brain doesn't get the oxygen and nutrients it needs. So overall, there's about 101 million strokes that occur, and 77 million of them are ischemic strokes. So this is the most common stroke that we usually think about when we hear about someone having a stroke or read about it. We can actually divide the ischemic stroke into 2 different types, thrombotic and embolic. So a thrombotic, which is about half of all the ischemic strokes, is kind of like a local blockage. All right. The clot forms right in the brain's blood vessels. And over time, things like fatty deposits, grease in a pipe, sort of like build up, right? So as that grease gets more and more and more and more, it starts to just build up and really get so narrow, like your artery gets really narrow that no blood can go through. So a itty bitty little blood clot can actually block that blood flow completely. So what do I mean by that, like grease inside a pipe? We call that atherosclerosis. So I'm going to skip ahead a slide and then go back. So atherosclerosis is this is a condition where your arteries and the blood vessels that carry oxygen-rich blood throughout your body become narrowed. And this is a buildup of that grease, or we call it plaque, right? And that's going to limit blood flow. So you can see here's our healthy artery here at the top. The blood flows through nice and free. But over time, someone that has high cholesterol, high blood pressure, smokes, you eat an unhealthy diet, lots of fats, this is actually going to build up a plaque, which is actually made of like fatty deposits, and start to build up on these artery walls. And as this builds and builds and builds, this is going to narrow the flow. So you can see here in the bottom, the blood isn't able to flow so easily. And something like this, like a clot, can easily block it. And that's how we could say have a stroke. And this can happen in all vessels of your body. A lot of times we think about this as what happens in our heart when we have a heart attack. The same type of theory applies. One of the reasons is that this can be very dangerous is it develops very slowly and often without signs until you actually get a clot, right? Or have a stroke or have a heart attack, that you realize that you have a lot of plaque buildup in your arteries. Going back to ischemic strokes, let's move on to the next type, embolic. So embolic is like a type of stroke where the blood clot forms in the body and it travels to the brain. Often this occurs in the heart or large arteries of your upper chest. Think about this as like a traveling blockage, okay? The clot forms someone else and travels through the bloodstream until it gets stuck into your blood vessel in your head. One of the big causes I always like to mention, because it's very common, is atrial fibrillation. Is a big cause of embolic strokes. And this is when blood clots form in the right atrium of your heart. And these clots can sit and pool. And then eventually you have a straight blood work. Your heart will shoot it right into your brain. So sometimes people don't realize they have atrial fibrillation until they come in with a stroke. And that's when they realize that they have this type of irregular heartbeat is the best way to define it. So the other type of stroke I'm going to mention is called hemorrhagic stroke. And this is less common, and actually is a little bit more devastating. And this is when the blood vessel in the brain ruptures. And this usually happens due to something like high blood pressure. Sometimes we hear about this when a patient has this trauma, right? They have a car accident or a big fall and they get bleeding in their brain. That's from an actual mechanical reason. People can just have this burst blood vessel in their brain for no reason that can occur at any time. And this kind of stroke happens very suddenly. And again, this is usually called by high blood pressure. All right. And this is because high blood pressure weakens our blood vessel wall. And over time, this eventually ruptures, right? Think of like that old garden hose, you use it over and over again every summer, and then it leaks from having just too much pressure running through it all the time. We kind of sometimes call this a brain bleed. And that's a big global term, but you'll hear that. These are often less, about 20% of strokes are hemorrhagic, and they're often more serious with potentially worse outcomes. Again, we can actually divide this more into types of hemorrhagic stroke. Intracerebral hemorrhage, or also sometimes called intraparenchymal hemorrhage. And this is when the bleeding happens in the brain itself, right? That direct blood rupture of the blood vessel. We can also hear another term that's called subarachnoid hemorrhage. So subarachnoid hemorrhage is when the bleeding occurs in the space between your brain tissue and the thin tissues that cover your brain. And this is often caused by a very sudden, very severe headache. And often in school, they tell you to remember it as the thunderclap headache. Like all of a sudden, it's more lightning, but that thunder, all of a sudden it just hits you that you have a terrible, terrible, terrible pain in your head. Um, and often this burst of blood vessel and this pain is linked to aneurysms. And this is when an aneurysm bursts. And this is what's considered a arachnoid hemorrhage is when you have an aneurysm that bursts. And you can see this little picture here. An aneurysm is this outpouching or a weakened area in a blood vessel where you get this like balloon appearance and that eventually can burst. Sometimes people have them their whole lives. Sometimes they never rupture. Sometimes people don't know they have them. But that's something that a lot of times we refer to when we talk about hemorrhagic strokes is that they had an aneurysm rupture. Again, less serious, or more serious, less common. A lot of times this is a very aggressive presentation. People will have a sudden headache. They will lose consciousness. And this eventually leads to more severe disabilities and higher rates of death. And this type of presentation, this type of stroke often gets worse within that first 24 hours. So these patients often are sent to a higher level hospital. These patients are often in the ICU for that first 24-hour period because they found that first day, that first 24 hours, things can potentially get worse very quickly. So you need very close monitoring. And I also want to talk about something closely related to stroke. It's something called a transient ischemic attack. So a lot of times people call this a mini stroke. And it's when the blood vessel in your brain gets temporarily blocked. And so your brain doesn't get that blood for just a short period of time. So kind of like that garden hose again, we kind of like briefly stepped on it and then let up again. All right. So everything returns to normal. And basically, a lot of times this is what happens when you have atherosclerosis or a buildup, and maybe there was a little clot that was there blocking it for a second, and then it moved through. So this is a big warning sign, okay? This is that dashboard warning sign on your car. This is telling you that you're at risk for a stroke real soon. Please get some treatment, get evaluated. And the good thing about a TIA, as we call this, is that these symptoms aren't permanent. So they usually resolve within minutes to hours. And so the patient returns to normal. It can be easily ignored, right? We can blow it off for stress. And so this is why sometimes this gets missed. One thing I will say is a lot of people that come in with a transient ischemic attack is they often have brand new sudden changes in their vision. Okay. And that's a big sign that a lot of times the carotid arteries in your neck aren't getting enough blood flow because it directly supplies your eyes. And that's a big indicator people come in. Again, unlike a full stroke, a TIA does not cause any permanent damage. Everything returns to normal. There's no lasting harm on your brain and body. But again, please take it seriously. It means you need medical attention. Otherwise, you could have a real stroke happening very soon in the future. So let's talk about these risks of stroke that I keep on mentioning. So when it comes to stroke risk factors, we have a couple types. We have what's called non-modifiable stroke risk factors. Basically, these are things that increase your risk of having a stroke, but you can't really control them, all right? They're part of who you are and your life history. So, for example, age, all right? The risk for stroke increases as we get older, all right? After age 55, the chance of having a stroke nearly doubles. But I always want to mention, you can still have a stroke even when you're young, all right? Even sometimes when you're healthy. It can occur at any age. So don't think that just because you're young, it can't happen to you. Family history. So if you have a close relative, like a parent or sibling who's had a stroke, your risk may be higher. And a lot of times this is due to shared genetics or shared similar lifestyle factors, such as high blood pressure and diabetes, which we'll talk about are stroke risk factors. Race and ethnicity. So stroke risk is higher in certain groups. And And this includes African Americans, Hispanic Americans, Native Americans. Like, for example, African Americans are about twice as more likely to have a stroke and um, uh, are more likely able to lead to death from stroke compared to the white American counterparts. And this can be related to higher rates of high blood pressure, diabetes, and heart disease that goes with African American groups. Also, gender. Like I mentioned, men are more likely to have a stroke at a younger age. Women are still at a higher risk after menopause, right? Due to hormonal involvement, right? Everything's hormones. It's always a problem. And also, women are more likely to die from stroke because we are having strokes at older ages, and a lot of times that makes it more severe. And then, like I mentioned before, if you've had a previous stroke or a previous transient ischemic attack, your chance of having a stroke is much higher, usually within that first year. All right. Again, like I mentioned, TIA is a warning sign that a larger stroke could happen. And they say, like I said before, 1 in 4 people are repeat offenders that they've had a stroke and they go on to have another stroke. So stroke risk factors that you can control, or we call them modifiable stroke risk factors, are things that can increase your risk of having a stroke that can be changed or managed or controlled through lifestyle choices or medical treatment. This means you have the power to reduce your stroke risk by making healthier changes. Let's talk about some common modifiable stroke risk factors. The biggest, most important, the number one cause of stroke, if you can think of anything from this lecture, it's blood pressure. All right, having high blood pressure, which is also called hypertension. All right, this puts you at risk actually for both ischemic and hemorrhagic strokes. Okay, excuse me. So high blood pressure puts extra strain on your arteries and makes them more likely to burst. And it actually wears down the inside of your arteries, make that easier and stickier for clots to stick to and block. They always say to keep your blood pressure below 120/80. This may involve having medications to assist with this, have a good diet, and exercise, sleep, all those aspects can help with that high blood pressure. Next is diabetes. So obviously some people with type 1 diabetes can always help the fact that they have diabetes, right? So this is more about that type 2 diabetes that you can acquire. And it's basically because diabetes, that sugar crystals, those sugar molecules, that actually damages blood vessels. And over time, it starts to wear them down. It can make your artery more likely to burst. And it also, like I said, can wear it down and make it a little bit more sticky and uneven and jagged so that things like clots stick to it better and that can block. And so it's very important that if you have diabetes, that you're managing your blood sugar and staying active, and it can significantly reduce your risk. Also, cholesterol. All right. Sorry. Too much cholesterol can lead to those fatty deposits in your artery walls that we talked about, the atherosclerosis. All right. Again, having a well-balanced, healthy diet, exercising, taking prescribed medications that can help lower your cholesterol can help prevent your risk of stroke. I like to also mention circulation problems because disease or conditions like peripheral artery disease, carotid artery disease reduces that blood flow to your brain. Regular checkups can help detect if you're having these kind of problems. I also like to include heart disease in this section as well. Like I mentioned before, problems with your heart can lead to blood clots or poor blood flow, which can affect your brain, even just the amount of blood you get. And like I said, if there's clots forming in your heart, it goes directly to your brain. Again, I know I mentioned it before, I'm going to mention it again, atrial fibrillation. Okay, this is an irregular heart rate, and it causes blood clots to pool in that chamber of your heart, and then they can be released and go straight to your brain. And so we have a lot of different ways now to treat atrial fibrillation. We have procedures and we have medication, and doing this can actually reduce your stroke risk by 70%. So I kind of mentioned this previously as I went over the risk factors, but some of the stuff seems probably pretty obvious. One of the big things is to quit smoking and vaping. We include vaping now. Um, and this is because smoking and vaping can actually raise your blood vessel. It damages that internal wall of your blood vessels. It can actually even thicken the blood a bit, which increases stroke risk. Um, Vaping can actually expose your body to other harmful chemicals that can affect your circulation. They say that current smokers have a 2 to 4 times increased risk of stroke compared to someone who does not smoke. Um, they also say that if you're quitting, actually drops your stroke risk immediately. And within 2 to 5 years, you can actually drop to the same risk as someone who is a non-smoker. So it makes a huge difference to stop smoking. And then they're reducing or eliminating alcohol use. So they do say that drinking too much alcohol can raise your blood pressure. It can actually lead to irregular heart rhythms that we know can lead to stroke. Um, and so they always recommend, 1 drink a day for non-pregnant women and 2 for men, lucky. Um, and so they really tell you to not to have more than that or eliminate it from your diet completely or very much limit how much you're drinking. And when it comes to weight, that extra weight on your body puts a strain on your heart, increases the risk for your high blood pressure, diabetes, high cholesterol. They usually all go together. So a 5 to 10% weight loss can actually make a big difference in lowering your stroke risk. What are their recommendations? They say a 30-minute brisk walk each day or about 150 minutes of moderate to vigorous exercise per week has been shown to improve health and well-being and lower stroke risks. And lastly, eat a healthy diet. So this is always like a big question. What's considered a healthy diet? Of course, they're going to say plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. They want you to limit salt, sugar, and have a minimally processed foods. I always say that one of the diets that they always say to follow that has a low stroke risk is a Mediterranean diet. That's been evidence to show that that does lower your stroke risk. There's so many diets out there, right? So a big thing, how do we know if we're having a stroke? So recognizing that patients having or someone you know is having a stroke and bringing them for treatment can make a huge difference in their outcomes. It can save their life. And we actually have treatments now that are time-based on when your symptoms start. So it's really important that we acknowledge, oh, at this time, this patient started having funny times speaking, their arm was really weak, they couldn't control the remote, because this is when your clock starts for possible treatment if you qualify. So because we have these new treatments, they were really pushing the media to really educate the public to come get this treatment. Because if you don't get it in a certain amount of time, we can't give it to you. So come if you're having a stroke. So they made this mnemonic about the signs and symptoms of stroke called FAST, which you may or may have not already heard about, okay? What they look for is your face, okay? Ask someone to smile, all right? Does one side of the face droop? Does it look uneven? Facial weakness is one of the first visible signs of stroke. Sometimes patients notice they start drooling for no reason because they have weakness. And then we also want to look at arms. So when we're worried about patient having a stroke and they seem weaker, have them raise both their arms. Does one fall? Can they not even lift one arm? Can they not even move it? Sometimes patients will have a completely numb arm. Do they not have any sensation? That's also very common in stroke and that you should come in right away to get evaluated. And then what kind of goes along with face is speech. Asks for speech. Have them try to talk normally or repeat a sentence like the sky is blue. Notice their speech. Is it slurred? Is it hard to understand? Does it sound thick? Oftentimes people can't speak or they'll say the same word over and over and over again because that's all they can say. All right. I can do it. And that's often a big red light that your patient's having, that someone you know is having a stroke. And then we put in T. So T is for time. And this is critical, right? Because this is going to see what kind of treatment options you can have. So sorry. Okay. I can do it. All right. The big takeaway from this, though, is that these are very sudden and acute changes. So all of a sudden, sometimes people fall over because they all of a sudden can't hold themselves up because they have weakness. All of a sudden, their speech all of a sudden gets weird. It sounds funny. They don't even know what's happening. It's very, very sudden. So if like you feel like your speech has been off for a month, probably not a sign of stroke. Okay. So then we have now a new change here. Experts now added a B and E to be fast to help catch even more strokes. And this is going to specifically look at balance and vision. Okay. We already know the fast, the B is for balance. All right. And this is when the patient all of a sudden has trouble walking. Usually they have like terrible, terrible dizziness. The room is spinning. And this is this is a new change. And could be a sign of a stroke that happens in the back of your brain. Same thing for eyes. Like I mentioned before, vision. You all of a sudden have double vision. All of a sudden, everything is blurry. You can't see anything. That could be a sign that you're having a stroke. Sometimes it's just one eye. Sometimes it can be both. Either one, go get checked out. So that's why we now say be fast to include those other symptoms that were being missed. People were having problems with their balance and didn't think it was a stroke, right? People had vision changes and went to see the ophthalmologist 2 days later. Come to the emergency room and get checked out, all right? I'm gonna drink some more water. I have this video. I hope it plays. I knew that was gonna happen, but I did put the link in here and I have it on my other screen, which of course I can't see because I'm in presentation mode. We'll see if this is gonna work if I click the link. Can you see this screen?
Yes.
Okay.
Now he's been wanting to put garlic chives in everything.
Well, not everything.
Dad, side of your face is drooping. Mom?
It's probably nothing.
Dad, are you okay?
You're slurring. Why are you slurring? Raise your arms up in the air for me.
Dad, are you okay?
Gracie, call 911.
I just
Honey?
Dad!
Tim!
Need an ambulance to Seven Fuller
Tim!
Avenue?
Tim, look at me, Gracie. Tell them to hurry. Tim, look at me. Look at me, Tim.
Mom, what are we doing?
I don't know. I think he's having a stroke.
I think my dad is having a stroke.
Tim, what's going on, baby? My husband, he's cold. Are you cold, honey? Are you cold? Okay. Gracie? See, Gracie's gonna come, sweetheart. We're just gonna go. We're just gonna go in the ambulance right now. We're gonna go to the hospital. Okay? Okay. Huh? I'm right here. I'm right here. Gracie, meet us there. I'm right here. I'm right here. Okay. Okay, here we go. You just stay right here. You just stay and breathe. Huh? Just breathe. Tim? Tim?
Dad? Dad?
How you feeling?
I'm fine.
Well, you've had a stroke. But because you got here quickly, you're looking at a full recovery.
All right, how do I go back to my slides here? Am I back to my slides?
Not yet.
Yeah. No?
Actually, you know what? Yes, you are. Sorry.
Yeah, okay. So that was kind of an intense video, but I wanted to include it to show that's how fast a stroke can happen, right? All of a sudden you're on your phone, all of a sudden you can't use that arm anymore. And then I like to like use this as like my little lead into, how do we treat a stroke? How did that guy get better so quickly? Because you could tell had lost strength on a complete side of his body, right? You could see his face was weak, his arm couldn't move. And what they had mentioned, because you got here on time, we talk about this. We call it time is brain. Okay. And basically, it's like speed matters when it comes to stroke treatment. So when someone has a stroke, as I mentioned before, your brain cells start dying immediately and they cannot grow back. So unlike a cut on your skin that heals, dead brain cells, they're gone forever. So that's why getting treatment immediately is critical, because we can sometimes save that occurrence of more brain cells from dying, right? We could stop that process. And so some of these stats I have in here, are kind of shocking, that every minute without treatment, your brain loses 2 million brain cells. Every hour without treatment, your brain ages as much as it normally would in 4 years. So like I said, time is brain. The faster you get treatment, the more brain cells we can save. And every minute that you delay can mean more permanent brain damage. So this is why I'm like, don't get in the car and drive yourself to a Boston hospital. Like, call 911. EMS will bring you to the nearest hospital that has stroke treatment capabilities. They're educated on this. They know what to do. They can save your life. So I want to tell you about some of the treatment options we have specifically for ischemic stroke, which, as you remember, is about 80% of all the strokes that we see. So this can really help a lot of people if they qualify. Oh. So what we can do is that we can give a medication that's called a thrombolytic. A thrombolytic means clot busting. It's a medication that can actually dissolve that blood clot in your brain. There's a couple different actual drugs we can use: alteplase, which we call TPA, or tenecteplase, which we call TNK. These medications are given through an IV in your arm, and you get it intravenously. And what this does is that it acts as like a powerful drain cleaner for your blood vessels. It breaks down that clot and it restores blood flow to that starving area of the brain. And once that blood comes back, like almost immediately, those brain cells can start receiving oxygen and nutrients again. And so, potentially you could lose a whole area of your brain, but if we can get that medication in, hopefully it's just a little tiny bit. That's what the goal is of this therapy, is to try to improve that blood flow to that area that is blocked. Here's the catch. There's always a catch, right? There's a critical time window. You must get to the hospital within 4.5 hours of when your stroke symptoms started. So if you, like I said, get into traffic and you're trying to drive in when the Bruins are playing, you're not going to make it. So this is also why it's important to go call 911. They can put their sirens on, or they can bring you to a nearby hospital that can scan you and give you this thrombolytic, okay? Most of the community hospitals have this medication and its capability, okay? So you don't need to come to a big Boston hospital. And again, we can give this in time. This can save your life. It can dramatically reduce your disability that you can have from a stroke, and will help you recover back to your baseline or recover more fully from if you did not get this treatment at all. We also have another treatment that's for ischemic strokes that's called a thrombectomy. And this actually means removing a clot. So it's a surgical procedure. It's technically brain surgery, where they actually go into the blood vessel in your brain and pull that blood clot out of the brain vessel. So it's like kind of like a tiny grabber, or like a little vacuum cleaner inside your blood vessels that's threaded through to pull and remove that clot out. One thing I want to say is that this is also only for eligible patients. Okay, you need to have a clot located in a certain artery, like a larger artery in your brain. And there's other capabilities about what it looks like on the scan. They can actually have scans now that can actually show if there hasn't been actual brain damage yet, if that area can be saved. We can do a thrombectomy. And your doctors will determine if you're eligible. The good news is that this has a much bigger time frame. We can do this up to 24 hours later. And like I said, we have to just check to make sure that those brain cells are salvageable to do this procedure, because it still is brain surgery. It's still a big deal. All right. And a lot of times what can happen is you can get both treatments. Okay, you can get a thrombolytic and they'll send you to the hospital that's capable to do a thrombectomy, and they can actually do the procedure as well. You can get both. All right. And in case that thrombolytic doesn't completely dissolve the clot, a thrombectomy can be actually more effective than just the medication alone, right? Because it's removing a clot rather than trying to work on dissolving it. I do have a small video. Let's see if this one works. It just shows you really quick what a thrombectomy is. Let's see if this works. Nope. Sorry. Yes, skip. This is a short video.
Treatment of acute ischemic stroke with clot retrieval device. Ischemic stroke is a condition in which normal blood flow to the brain becomes interrupted. When a clot becomes lodged in one of the arteries that supplies blood to part of the brain, the tissue is deprived of oxygen. Clot removal devices are designed to treat ischemic stroke by removing the blood clot from the artery. The clot removal procedure begins by advancing a guide wire through the blood clot within the artery. A microcatheter is advanced along the guide wire until it is beyond the clot. The guide wire is retracted and the clot retrieval device is advanced through the microcatheter and deployed as the microcatheter is retracted. Once unsheathed, the device expands, pushing the clot to the walls of the artery and immediately restoring partial blood flow. Over the next 2 to 5 minutes, the device becomes embedded in the clot. The clot retrieval device, along with the blood clot and microcatheter, are removed from the body. Blood flow is restored and verified with imaging. The entire procedure typically takes less than an hour.
Cool, huh? Can actually have brain surgery and not even tell, right? Because they go in through the big artery in your leg and they thread it all the way up. Yeah. And you know what they pull out? This. These are pictures of clots that they pulled out of people's brains. Look how small they are. That's enough to literally kill you. But this is what they'll actually retrieve. Yeah, I think that's pretty cool pictures. So I'd like to just quick go over what happens when you're having a stroke and you need this treatment. What are you going to experience, and how do we know which hospital to go to? So not all hospitals are equal for stroke care. They're kind of like trauma centers, all right? We have different levels of capability, and stroke centers are certified at different levels. And this is a lot of times based on what treatments and expertise, if they have an operating room suite that they can offer. It's kind of like, right, going to a clinic versus going to a specialized hospital. Each level can handle more complex cases. So we have the 4 levels, as you can see here. The acute stroke ready. There's a stroke team. They can evaluate you. They can give you, you'll need a scan, a CT. No matter what happens, if you're having stroke symptoms, be prepared to get a CT scan. And they can give you that thrombolytic medication at these hospitals. Again, these are your smaller hospitals, rural hospitals, some of the community hospitals are acute stroke ready. It's like a first responder level of care. Then there's a primary stroke center. And this is a stroke team. It can do the same thing as acute stroke ready, where they can give you the scan you and give you the thrombolytic. And they actually have specialized stroke beds in the hospital so that you could be admitted to the hospital and be monitored there. and be discharged or go to rehabilitation from there. They have all those capabilities to help you during that transition time. But those more complex stroke patients, like hemorrhagic strokes, need to go to a higher level of care. So primary stroke is like your standard stroke care. And many of the community hospitals are primary stroke center certified. And then one of the newer levels that have just come out is something called a thrombectomy capable center. Again, everything primary stroke center does, plus they can do thrombectomy. So they have an operating room. They have a vascular or neurosurgeon that can do the procedure. They're available 24/7 and can handle a lot of the stroke patients that come in. The only ones they can't handle are those hemorrhagic patients. Those complex or those hemorrhagic patients have to go to a higher level of care. And that's going to be your comprehensive stroke center. This is your top of the line stroke center, right? We can do everything here. Scan you, thrombolytics. We can bring you right to the operating room suite from the emergency room sometimes to have you get that thrombectomy procedure. We have neurovascular experts. We have a neurocritical care. We have an ICU specialized in specialized neuro nurses that know how to take care of stroke patients. And this is where the complex and most severe patients will go to the comprehensive stroke center. So I will say that all these other strokes have contracts with comprehensive stroke centers. So we all have transfers and agreements for our patients to be transferred. So again, if you think you're having a stroke, they a lot of times will bring you to the closest hospital, right? So paramedics, when you call 911, because you're going to call 911, those paramedics are going to know what nearby hospitals are certified and get you the treatment you need. Now they sometimes have the capability, if they think you're having a very large stroke and that a thrombectomy would be appropriate for you, they'll skip these and can bring you to a higher level of care. And so sometimes it'd be worth bypassing, for the time is brain. So that's one of the things that paramedics have that capacity to do, and that's why it's always so important to call 911. And I will mention, I did make a list here. The comprehensive stroke centers are Mass General Hospital, Brigham and Women's Hospital, Boston Medical Center, Beth Israel, Deaconess Medical Center, UMass Memorial Medical Center just got their CSC as well. For in the local area. So people always ask, what are the CSCs? And then, like I said, what happens when you're in the hospital? Let's go over what to expect. We're going to be watching you very closely. We're going to be doing what's called neuro checks on you, neurological assessments. We're going to ask you your name, where you are, squeeze my hands, lift your arms, push with your feet, right? And these are just checking to see how your neurological status is, and if anything changes, that we'll be able to assess that and know that, and get you the appropriate care. We'll be checking your blood pressure, your heart rate, your temperature. Most, if not all, stroke patients will often be put on a cardiac heart monitor for the first 24 hours of their admission to check to see if you have an irregular heart rate, right? That atrial fibrillation sneaks up on people. Also expect to get poked with some needles. They're going to do blood works. And this can mean they'll call, a stroke workup, which could just be anything from electrolytes, which are minerals in your body. We'll look to see how well your body is clotting. We'll look to see what your red and white blood cells are doing, and a bunch of other tests just to see if that's going to help with the picture of your stroke. I always tell people, you can get lots of brain scans, lots of pictures. Okay, sometimes that's the best way to see how things are changing and to get more information. I always say you're going to get a CT scan. There's a good chance you're going to get an MRI. Sometimes we'll do ultrasounds that we can look at the arteries in your neck, for example. Sometimes people will have that. And a lot of times this is how much damage occurs, what the damage is. That's going to give us a lot of information. And then I always want to mention that, your stroke team is full of a ton of people in the hospital. It can be very busy. All right. You have a physical therapist that works on your movement. You can have an occupational therapist that's going to help you during your daily activities like dressing, paying bills, bathing. We have speech therapy for those that have trouble speaking from the stroke if they have, or trouble swallowing. You can see speech for that. Even understanding language, speech will help you. We have case management, which is a coordinator of the care you'll need for when you leave the hospital. And then we have social work, which is a lot of emotional help. I just can't make it through. I thought I could. Oh. And then chaplaincy for spiritual support. So sorry, guys. Also, some things to talk about. Medication management. So a lot of times we are going to be looking at like those vital signs, looking at your blood pressure. Do you need medication to help with that? Same thing for your cholesterol level. We also a lot of times put people on an anticoagulant. We also call that a blood thinner that help prevent new clots from forming. And oftentimes aspirin. So aspirin actually helps prevent clots from forming and reduces our stroke risk. And any other medications. So you might be starting new medications in the hospital. I always tell people, get ready to get moving in the hospital. You're not going to sit in that bed. No, we are going to get you up. We're going to get you up in the chair. You're going to be working with PT. You're going to be working with OT. We're going to be helping you. If you need assistance, we're going to work on your range of motion. The more you move and the sooner you move, the better your recovery. It helps with your brain health. I'll go over that, my last slide. And then we have a lot of help for your discharge. All right. We start planning right away. A hospital stay, it kind of depends, right? Usually 1 to 7 days. Sometimes you'll be in the intensive care unit. Sometimes you'll be on the general floor. And then you have options. You can go home. You can go home with services. You can go right to an acute rehabilitation center. And if you need to do palliative care, oftentimes many facilities have that, or we can send you to a hospice facility as well. We also want to make sure you understand what happened, right? What type of stroke you had. Did you have an ischemic? Did you have a hemorrhagic? What are your stroke risk factors? What can you do to prevent them? What changes can you make so that you don't have another stroke? Because now you're at higher risk, remember? So this is one of my favorite things about stroke is something called neuroplasticity, because this is how we recover, right? This is how people get better from a stroke. Because the brain is the coolest organ. I know I'm biased, but I think it's the best because it actually can retrain itself. All right. It can take over those lost functions, right? That area that died, those brain cells we don't get back, your brain can make new connections and work around that so that you won't even know that you had a deficit to begin with. It basically rewires itself. Think of it like a city with roads. If one road is damaged, the city just makes another road around it to get traffic flowing again. And that's what your brain does. So that damaged part of your brain, again, you can't get back. But your brain learns to take over those lost functions and makes new connections to help you regain those abilities back that you may have lost, such as speech, movement, vision, hearing, which I think is the coolest thing. And they say that recovery starts within a few days after your stroke. It can take months to years to see a full improvement. Sometimes progress is slow, and that's very frustrating for patients and families that want to be back to themselves again. No one likes not be able to use their right arm if that was your right arm dominant. You know, they want to be able to write. They want to be able to use the clicker. And so that's hard, but recovery can happen. And I always tell people when they ask, like, what's the best thing that I can help a loved one who had a stroke is use it or lose it. Okay, using those affected body parts and practicing new skills helps your brain recover faster. The more you practice, the stronger those new brain connections become. So if you don't challenge yourself, you don't use the brain, those abilities can weaken over time. So that's why we push you into therapy and practice, the same things over and over to keep that brain challenged, because that's how you recover. And also, I don't have it in here, but I always say having positive attitude about it makes a huge difference as well. So, how did I do on time? Oh, I'm good. 4 minutes early. So sorry about the coffee, everyone. I thought I could make it through tonight. It caught up to me. I know that there's a couple questions in the chat. Let me take a look here. Okay. I'm going to go right back to the top.
I'd be happy to.
We had to speaking quick. I apologize.
We have a question regarding stroke rehab programs. Are there any at Mass General once the patient is discharged? If so, do you need to be treated at Mass General in order to access these services?
So there are no specific stroke rehabilitation programs at MGH. However, MGH is part of I guess a program is called Mass General Brigham, MGB, and they are associated with some stroke rehabilitation hospitals, such as Spalding Rehab is a very large rehab recovery that we send a lot of stroke patients to. Also, lots of different other types of patients that need recovery go to Spalding, which is an MGB facility. A lot of times what the case management manager will do when looking for places for your loved one to recover after a stroke, it's a lot of what type of level of care they need, what's close to you and your family, or what's best for the patient. We've sent some patients to like specialized rehabs in Colorado, all right, because that's what the family wanted, because it was very specific to this type of injury. Some patients, want them to stay at Spalding even though they live in New Hampshire, but they know that they'll get that rehab services they need in Boston, or they'll send them to a place similar in New Hampshire. So that's what some of the things they look at when a patient needs to go to rehabilitation. It kind of depends on the whole picture.
Thank you. We have attendee who is mentioning how they can move their left arm while feeling numb and swollen. Is this a sign of an early stroke?
Oh, that's a tough one. I would probably, if it happened suddenly, that's when I would say be concerned. If you're still able to move it the same, but it's just now becoming more swollen, it's tough because it's a swelling causing the numbness. I would always say get it checked out. I always want to err on being safe because you never know. But that's a tough one. But yeah, I would say get it checked out. May not be a stroke, but it could be something else that's important to know anyway.
Thank you.
Mm-hmm.
Are there any websites you would recommend for one to visit to learn more about stroke?
Yes. One of my favorites is the American Heart Association has a huge patient education section that I often go get information from myself. There's also a website from the Department of Health. They have a very big stroke center that was actually developed by a stroke patient, a donor, gave a lot of a large donation. It's called the Coverdell, and they have a lot of stroke information to the Department of Health because of that donation. So they can give, I think you can get like free information, like fast posters and like fast magnets and that kind of stuff through the Coverdell program. So the Department of Health, if you look up on stroke, they do have an abundance of information as well.
Thank you.
Mm-hmm.
So we are at time, and I don't believe I see any further questions. Before we end today's session, do you have any final thoughts you'd like to share with the audience, Angela?
Well, I just want to thank everyone for showing up. I apologize that for the sickness and the coughing. But I appreciate everyone showing up, and I really hope that you can help share stroke education. That's my goal, with people you know about the importance of recognizing stroke. And if you need anything, I do have my email up here. If you want to reach out, please do.
Wonderful. Thank you so much, Angela, for your time. This was very helpful. And
You're
for
welcome.
everyone joining today, thank you so much. As I had mentioned, today's session is being recorded. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. I also entered that web address in the chat. All right, everyone. Thank you so much. Have
Thank
a
you,
good
everyone.
evening.